Hi there. Welcome to the High River District Healthcare Foundation. My name is Jody Seeley, and today, as a part of our healthcare conversations, we are joined by AHS's Clinical Supervisor from Rural Addictions and Mental Health South. You guys have the longest titles in this organization. I love it. Alex Cameron is with us today. Alex, thank you for having a conversation with us.
Yeah, thanks for having me.
This month, in our women's health focus, we've been having some conversation throughout the foundation's social media about mental health. And I think there's a huge campaign that happens across the country next week called Bell Let's Talk Day. And so there's a lot of talk around mental health in January. So we thought we'd sort of start some of that conversation with the goal that I think we always want to be having conversations about mental health to help keep us talking about it and reducing stigmas. But it's not an easy topic to just bring up in conversation now, is it?
It really isn't, and it's there's a huge layer of vulnerability in being able to express I need help or I'm struggling or something's challenging for me right now. And I think just to your point, by being able to normalize that conversation is so key and so important. How many times have we walked down the hall and said, "Hey, how are you?" And when we get someone saying, "Oh, we're not good," you're like, "Oh, I wasn't expecting to hear that. I was expecting just to hear I'm great or I'm fine." But it's about just creating that space to start having these conversations.
Well, I think sometimes, do you find people maybe, especially lately, after going through 2 years of a pandemic in this world, and we're kind of all
Mhm.
feeling emotions we've maybe never felt before, do we feel a little ill-equipped to really ask somebody how they're doing?
I think we do for sure, and I think also we create more importance around asking the question that we have to have the answer, and I think that's one of the big issues is we don't have to have the answer. We don't have to be the one that fixes it. We just have to be the one to ask the question and to just genuinely say, "How are you? How are things? Where are you at?" And then let people know that I'm here to support you to get the help, to get the professional services in place that are set up to give you what you need.
Absolutely. And there's a strength in listening and a strength in
Hmm.
acknowledgement that I think we sometimes forget that little piece of, although it feels like maybe you're doing nothing, how many
Yeah.
stories have you heard that people maybe were in the downest of down days and somebody smiling at them or saying hello to them stopped them from going through with, say, something as severe as suicide?
Yeah, absolutely. And I think it doesn't take much to just validate somebody for someone just to feel heard. And we're social creatures. We want to connect. We want to be seen. So when someone says, I'm really struggling, like, "Oh, tell me more," or "I'm so sorry to hear that." And just, again, be there, be present, tap into that empathy place. And for me, I think it's that difference between sympathy and empathy, where sympathy is, okay, I'm going to feel this for you. I'm going to take this on. I think that worries us because, oh, now what am I going to do with this? Versus an empathy standpoint where it's, yeah, I understand that. I know what it's like to feel sad. I know what it's like to feel pain or anger and frustration. So I can touch that place in me that allows that other person just to be understood. And that is probably the majority of the work we do in therapy, is creating that space for someone to just feel understood.
Yeah, absolutely. When I think too, January always becomes an interesting month. And, although our focus is on women's health, and I'm going to have a really women's perspective in my next question to you,
Mhm.
Alex, this falls into the realm for no matter what your gender is. I think these pressures come into play. But I really feel like marketing from companies in January is really geared towards women, focusing on resolutions and changing yourself and creating those expectations of what your year is going to be and who you are as a person and what you're going to change in your life. And January comes with this bag of pressure for
Mhm.
women and all people to be better and different. And I think 2 years into a pandemic, on top of that, we have this really wild bag of emotions that's happening for people. And how do we manage and get through this weird pressure month?
Yeah, that's a great question. One of the things I think where we just start is, how do we just start to be more kind to ourselves and just sort of, what can I do today? What's one step forward? What's one thing that's going to help me shift and be a little bit more comfortable, a little bit more at peace, a little bit more at ease, as opposed to these wholesale shifts. I remember back when the pandemic, when the lockdowns first came in, and people were like, oh, I'm going to learn a new language. I'm going to go do this, and if you didn't finish a 5,000 piece jigsaw puzzle, then what are you doing with your time locked up at home? And I think we forget that a lot of us we're just getting through. We're just trying to get through our days. We're just trying to sort of get fed, clothed, kids to school, all these things. And there is that tremendous amount of pressure to always achieve and always be doing something more. And with social media, of course, we're inundated with that day in, day out. And I think it's just about where am I at and what's going to be most helpful for me moving forward, but also trying to understand and support those people in our lives. And I think one of the pieces is, yes, I identify as male, but I have a mom, I have a grandma, I have sister, I have aunts, like all those things. So we all have women in our lives. And we all can support them through that. And just, again, going back to what you said earlier, how do we just hear them? How do we understand and check in and say, I notice you're overwhelmed, or I notice you're busy, or I notice there's a lot on your plate. How are you? And that can just be enough to just someone say, you know what? I'm really struggling. I need some help here. Okay, let's find out how to do that.
Well, and I think that, I don't know if it becomes if it's part of genetic makeup or if it falls into traditional roles in homes, but the woman tends to be the person who's kind of managing and running the elements of the house, especially around feelings. And that's the place where it can feel the most overwhelming. And so, yes, there's, male figures or other gender that is contributing to the management of the household. I think if we speak in a traditional fashion, it falls to the women. So if we can ensure that, and that's kind of the focus of the foundation, if we're ensuring we can support and build the women of our community, that's going to fan out, and the ripple effect is going to be huge to every other member of society. So how else can we support women? Or if you are a woman watching this and you're feeling all of those pieces, like what's next, Alex?
Mm-hmm. And I think it's really just about when you start to identify, like I don't feel maybe in control of my decisions, or I don't feel in control of my thoughts or my choices. And sometimes I'll talk to people who will say like, Alex, I'm experiencing a high level of anxiety. Yep. Anxiety is a very natural human emotion for us to experience. But when anxiety starts to make choices for us, so it's one thing to be like, I don't really want to go to work and I'm feeling a little nervous about it, but I'm going to go, versus, nope, I can't go because my anxiety is so high. So I think it's about checking in with ourselves a little bit and understanding where I'm at, and then saying to someone you trust, I need some help. I need to talk about something, or I need some support. What might that look like? So that might be your partner, it might be a friend, or it might be a professional referral service, or starting to sort of reach out to professionals in the community and whatnot, or your doctor, someone in your faith community. All these areas, I think it's just about letting people know that you're seeking some sort of help, or that you're experiencing something. And those places where you trust people to hear you, that's first and foremost, I think. And then finding out what are those options that are available to me that are maybe more formal than informal. Because I think the other piece with our pandemic is what we've noticed is, and I see this with a lot of my own clients, is those informal supports that we got from going into the office and having those chats with people and getting away from home. That's gone by the wayside for many people who are working from home, as you and I are sitting in our homes right now. And so we don't get that human interaction the same way that we used to. And then we need that to keep going. I think as that's lessened, we haven't replaced it with other components of self-care or different things to help keep us moving forward. So it's more on top of us while doing all the same responsibilities.
Yeah. Well, I think it comes to an interesting element to also address in the conversation is that probably one of the hardest first steps for people is to say that I'm not doing okay. Like for some reason we get really stuck in human, whether it's from our conditioning or upbringing or whatever those layers might be in everybody's life, but we have a really hard time saying that piece out loud.
Mm-hmm.
How do we manage that, like that first step? Because it's the biggest one. Like there's lots of things that can be brought into place after, but we have to start somewhere. How do we start?
Yeah. And I think the first thing can just be finding someone you trust and just saying, hey, do you mind listening to something? Can we have a chat? Can I share something with you? And it doesn't have to be the right door, but it's a door. And so we're opening that up. And you're right, it is tremendously difficult. And when I think about like that vulnerability piece and thinking about, for a lot of folks, well, if I say I'm struggling, am I weak? Am I losing? Am I less than? Absolutely not. I think vulnerability takes tremendous strength and courage. So I think it's the exact opposite, to stand up and say, ugh, I need some help. I need to talk about something. And I think just by starting that conversation, you're already taking a huge step, and all the subsequent steps become a little bit easier. So not that they're just going to become easy, if everything was easy, we would all do it. But I think, if it is someone that you trust, or like I say, all those people I just mentioned, but saying, yeah, do you have a minute to chat? Can we just have a conversation? I just want to share some feelings I'm going through. And that's the best first step. And then you can start to see, like, for some people, that's enough. That's enough to just, okay, that helped. I've got that support, whatever that looks like. For some people, it's, all right, this feels like I need more of this. So then what are the next steps?
Yeah. Well, and I think too, it becomes a checking in on other people's scenario too. If you've noticed that one of your friends or coworkers or someone in your life is just a little off than what they normally are, ask them. And again, you don't have to know the answer of how to help them. You don't have to become their new therapist. You just have to check in. And I think we hesitate to do that because we're like, what if they tell me something really bad?
Yeah.
Like, what if they're not okay? What am I supposed to do as that person?
Yeah.
And that, I think, stops us. So how can we be the supportive checker-inner?
And
that's a technical term.
Yeah, I think we should coin that. We should probably copyright that. But I think it is about just knowing that by just asking, I'm doing more than I can even imagine. Yeah. By holding space for someone to share, I'm doing more than I can even imagine. A real quick story. I used to do street outreach in Vancouver in their downtown east side. And so walking around in the streets and alleys and people living homeless. And I remember a fellow just said, hey, can I ask you a question? Yeah. And we chatted for 5 minutes. And then he said, thank you so much. That meant the world to me. I just needed to talk to somebody. And just that human connection, just that space to be, someone heard me, someone understands me, someone cares enough to just listen to me, is so powerful. And so we don't need to have the answers, but that support of being there and connection is so, so powerful. And I think we minimize that or don't understand how important that is.
Well, and I think that's been minimized even more so through this pandemic. So now it's time to, we got to turn that around. We got to do some more connecting. But I could talk to you all day about that. But what about, I think, as women in the household and parents in general, we're seeing a lot more challenges for our kids through this time frame too. So how do we help navigate big emotions that most of us don't really understand in our own selves, but if we're seeing those big emotions in our kids, how do we navigate that area?
Yeah. I think the first important piece is, how do you create a safe space for your kids to express whatever it is that they're feeling, whatever it is that they're experiencing? Because I think for a lot of times youth are afraid to express themselves for fear of getting in trouble or making our parents angry, or I did something wrong. But how many parents would say, if I could go back after maybe they've lost their child to drugs or, suicide or whatnot, say I would have just listened. I just would have been there. I wouldn't have been angry. So it's about creating that safe environment within your family, I think, to ask those questions, but also to tell your kids, if you're ever feeling unsafe or if you're ever feeling like you're struggling, come talk to me and I will just listen. And I think that piece is sort of missing. There is that disconnect. And again, we're working from home. We've got all these responsibilities on our plate. Kids are supposed to be in school. We're trying to manage how many computers we have and internet access and all these things to get everybody moving in the right direction. And that's all really hard. And it's a weight and a burden on all of us. So I think similar to what we just talked about, checking in with your kids and saying, hey, how was your week? Taking some time, put your phone down, be present with them, have those conversations over dinner, schedule some time with just you and one of your children or just you and your child to say, hey, how was your week? What's going on for you? How's school? But to go deeper than, again, like we talked about earlier, just that surface. How are you? Oh, I'm good. Okay, cool. Like I asked, my kid tells me they're fine.
They're fine.
Yeah.
We're all fine.
Yeah, there's that great meme that goes around the internet where there's the dog in the room and everything's on fire. He's like, "This is fine." And I think that's a lot of us right now. We're just getting by.
Well, and I think that it steps with the identifying. And I wonder too if people get caught up in, like, I think we've come a long way in having more mental health conversations in our world, definitely over the last 10 years than we ever have. But like something that becomes a trend, and I'm going to say that because I think sometimes mental health conversations become trendy, is that we get lost in what is a mental health thing, what is my mental wellness versus a mental illness. And then we get confused and stuck into labels and those like the catchwords you're hearing all over internet or wherever. So how do we identify where we sit in that and not being afraid of one versus the other?
Yeah, absolutely. And I think when I think of mental health, I think of it as a continuum. So at one end, we've got mental illness, and the other end, maybe we've got mental wellness, let's say. And we can be anywhere on that continuum at any given day, at any given time. And so it's about understanding, like, how am I functioning? Am I getting by? Am I doing the things I want to do? Or, is my mental state making choices for me? Is it something where I need to maybe interrupt what's going on here? Now, mental wellness, I think, or mental health, again, because it's that continuum, can we get to a place of mental illness? Certainly. Can that be exacerbated by environmental components? Absolutely. There's an author, Brene Brown. She's quite popular. Many people know her. I listened to her once say, when it comes to mental illness or mental health, genetics loads the gun and environment pulls the trigger. Meaning we all have that in us, but when we're surrounded by distress or whatnot, that can really exacerbate, moving us maybe closer to a mental illness place. Now, the way that our clinics work, for example, we do talk about provisional diagnoses and different things to sort of understand where we're starting, but we really are looking at symptoms. We're looking at what the person is experiencing. So if someone comes into my office, and says, "Alex, I have this diagnosis," or "Alex, I'm experiencing these symptoms," I'm going to work with them the same way. Because you might say, "I have depression," or "I have an anxiety disorder." Okay, what does that look like for you? What are the challenges that you, the individual, are facing? As opposed to, "Oh, anxiety disorder. Okay, let's get out the cookie cutter and like, here you go, and take 2 of these and call me in the morning."
I Googled this. I know exactly what to do. Yeah,
exactly. Yeah. So it is about just understanding where people are at. And sometimes some of the work can be preventative as well. And diagnoses really are like a best guess a lot of times because, humans are fallible, and we're sort of like looking at, here's what the client is telling me, here's what they're experiencing, and here's what I think is going on. But again, what does that look like for you, the client? And let's address those issues that are important to you, that are going to help you feel like you're on top of things, like things are shifting for you.
Yeah. There's a lot of moving parts in
Absolutely.
this topic, isn't there? Like,
yeah.
So many moving parts. Well, when it comes to our area, Alex, what are some of can we talk a little bit about what are some of the services that are available to us? So if we're seeing this and we know, okay, there is, besides just having a conversation with a friend, I need the next step. Not everybody knows what those next step looks like, or you hear people's like experiences versus reality. Like, how can we kind of lay it out for people of, if you're needing that next step, how do I take it?
Yeah, absolutely. There's a lot of different options out there. We're ranging everywhere from sort of private services, so people who work for themselves, who are fee for service, to free services, and kind of everything in between, like not for profit, etc. And so some of the areas, talking to your doctor, expressing some of those things, or your primary care person, that can be a good first step. If it's something where you're concerned about safety at all, or it's really exacerbated, being able to present at your urgent care or emergency area. If it's something where you're having thoughts of suicide, or someone's having thoughts of harming someone else, that's a good place to start as well. And they can often have people to connect you with other services. One big one is through AHS, is called Access Mental Health. And so they are a 1-number hub that you call and you do an intake with them, and they will sort of go through an assessment process and understand what it is you're looking for, look at kind of what a level of care you might be requiring based on what you've shared, and align you with whatever service is available. Now, they are through Alberta Health Services, but they do also refer to services in the community. So the majority of people, I understand, are not referred to necessarily AHS services, but community services. So these might be places like the Calgary Counseling Center or whatnot that are offering really good counseling work that are a not-profit, but are accessible and affordable. And the nice thing right now too, with everything being virtual for the most part, is we don't have those barriers to connect to those places. So for example, our services, we can start to see people like maybe who live further out in say Nanton or something like that and say, well, I couldn't make the drive in because of work, but you know what? I can get home and jump on the computer here and have a video call. So Access Mental Health is a great resource. If you Google them, it comes up, you get the number. They're Monday to Friday, and they really are that one-stop shop to say, like, what is out there and where can I go? And I think that is a great starting point.
Yeah, and I love that. And that it makes it just easier. I think if we can take some positives out of the pandemic, for sure, is the fact that services became online like that, to be, especially for those in our rural communities, this becomes a really great tool for them to be able to have more connection and conversation, for sure.
Yeah, absolutely. And I think too, it's about taking away barriers. And I think that's what they were trying to do with this Access Mental Health. So if you call them and you can leave a message, someone will get back to you. You know, it is about being able to get connected quickly. Now, they might refer someone to our services, but our services are more geared toward that moderate to severe mental health piece. So some people might say like, oh, I'm struggling with some feelings or whatnot, or some emotions. I want to go to my local addictions mental health office. We may not be the right fit for where that person's at, because we're sort of like that higher level, that up escalated level. But that doesn't mean we're not trying to be gatekeepers. It's just like, where are you at and what's going to be most beneficial for you? And that's how we keep sort of wait times low, et cetera, and don't have a wait list, because we are connecting people with the right services if they're not us.
Yeah, fanning out to the right area. I love that.
Yeah,
Thank
absolutely.
you. Now, I know we've kind of talked sort of the higher level help scenarios of today, but I thought before I let you go, maybe because you've been in this business for a long time, Alex, you've worked with a variety of ways to help people manage, even if it's just feeling stress. Like, stress is another one of those words that is an umbrella for a huge amount of things. And so could you give us sort of, I don't know if you have like a list that comes to your mind of like tips or tricks or ideas that people can do in the meantime, if it's just, I'm just feeling overwhelmed or I'm stressed. I'm not sure I'm in a place where I need a conversation, but I'm definitely in a place where I need to figure out how to relax. How can we do some of those things just on our own or within our households?
Absolutely. One of the things I think that is really popular right now is this idea of mindfulness. And we've heard a lot of talk about it, and it feels maybe more like a catchy thing, but it's actually been around for a very long time. And so being able to just be still, check in with ourselves, be in this moment. Because I think when we talk about anxiety, that's that future oriented, the what if. Well, what if I leave the house? And what if a piano falls in my head? And what if? That's the anxiousness. When we look at more depressive symptoms, they're more often related in the past, like, oh, my goldfish died 6 months ago, I fed him too much, that sort of thing. So if we can be in this moment and understand that in this moment right now, I'm okay, and all those other thoughts where my brain is taking me aren't affecting me right now, they're just simply thoughts. And so one of the pieces around that, I think, is I often talk to clients about self-care. Now, this is also a pretty catchy, trendy phrase right now, but I think it's important to define what self-care is versus avoidance versus distraction. So sitting down and binge watching Game of Thrones, not self-care. It's avoidance, it's distraction. I feel better in the moment when I'm distracted and have something in front of me. But the way that I talk about self-care is, what is something that I can do that afterward I will feel better? I will feel more energized. I will feel recharged. Now, that might be painting. That might be some meditation. That might be spending time with friends. That might be just being quiet in my room without any distractions. Half an hour away from my family or my children who are running around tearing the house apart. So to me, being able to check in with yourself and say, what are the things that I enjoy? What are the things that when I do them, even for 10, 20 minutes afterward, I feel better having done that. So it's less like specifics of here's the top three things, but checking in with yourself because everybody's different and everybody has a different need. So if you're saying, I need to do something, what will I feel better after doing it versus am I just doing an avoidance? Am I just trying to get away? Am I just scrolling Instagram? Am I just going back to Facebook? Am I just getting caught up in TikTok for an hour? I mean, those are great distractors, but I wouldn't label them as self-care. And I think that's the piece there. So it's about finding that thing that's for each person. And when I talk about mindfulness, for example, there's lots of apps out there. There's lots of stuff on YouTube for guided meditations, guided mindful stuff that can really help to just bring us into that moment and bring that level down. Because when we have those stress moments, so we get into that fight or flight response and the adrenaline and the cortisol's ramping up, how do I just take a breath and let everything settle? I think that's what we're not getting enough of right now.
Yeah. And would it be fair too to say, Alex, that it probably will take people a couple of times of doing, like if you're not usually practicing mindfulness or you've used distraction instead of self-care, because you've explained that so beautifully for us. So thank you. Is maybe the first time it's going to feel awkward because sometimes the most simplistic, I'm sorry to call it that, but really like if you're saying like have a bath or go for a walk or, do a mindfulness app, it seems so simple. And we're in this state of mind where everything's so overwhelming. It might take you doing it a couple of times to realize that's your piece. Yeah, or maybe you have to try a couple of different things. Would that be fair?
Absolutely fair. There's no one and done. There's no light switch flip for any of this. It is about practice and incremental shifts and changes. It took us how long to get to where we're at? So it's going to take us a while to get out of that as well. And I think one of the things, my brother and I talked about once was there's simple and there's easy, and they're not the same thing. So these are simple things to do, but that doesn't mean that they're easy. Finding 20 minutes by yourself, simple, but may not be easy to do when you've got other responsibilities and things going on. So how do we make it easier? How do we engage with maybe our partner or ask the kids, hey, you know what? I need you to watch TV for 20 minutes because I've got something to do, but to sort of collaborate and create that space for yourself. Because I think over time you'll notice it, but it's not going to be, wow, I feel so much better a week later. It's probably more if you stopped doing it, you'd really notice things ramp up, and it is incremental. So it does take some time to make those shifts and changes.
Yes. If you can only do 5 minutes the first time, take 5. It's still better than 0. If
Absolutely.
You can't do all 20 or whatever. And just reminding ourselves to live in grace through that. Again, like I love how you said simple, not easy, is that I think we put, again, that pressure piece comes in. They'd be like, I should be able to just take 20 minutes and chill out. But if I can't, live in grace of what that is and know that you can build to it.
Absolutely. Should is a 4-letter word, honestly. Yeah. And I had a client say, sorry, I'm shitting all over your office. But it really is because it's blame and it's responsibility and it's guilt, as opposed to, rather than saying, I should take 20 minutes, I'm going to take 20 minutes. It's much more empowering and it moves you forward. And if you decide not to, then it's a choice rather than, I failed because I should have been able to do 20.
Yeah. Should and fine. We got to get rid of those 2 words.
Yeah,
I'm sure I could talk to you for 1,000 hours, Alex, on this conversation alone, but just want to say I appreciate so much you taking the time to break this down. We've got lots of comments coming in from people saying, oh this has been really great info and thank you. And we've linked to the Access Mental Health into the comments also, and we'll keep posting that. But thank you so much for sharing some information with us today and giving us some language too that can help us identify and move around some of these challenges we're having.
Yeah, and it's kind of like any step is the right step. It's a first step. And with my manager, we often talk about every door should be the right door, because it's just going forward. So if you take that first step, and that it'll be the hardest, but it'll be the most important.
Yeah, I love that. Alex, thank you so much for joining us. Thank you, everybody. Share this video onto your social media. Let's get information sharing across our platforms on how we can help each other and connect better with each other. I think would be a great goal. And Alex, it's National Hugging Day today. I'm not sure if you
Oh,
knew
I did
that.
not know that.
So I'm hoping you've got someone you can give a hug to as well later, because we could probably have a whole convo on the science behind how a hug is so beneficial.
Absolutely, yeah.
All right. Thanks, Alex, for joining us. Thanks,
Thank you.
everybody. And thanks for being a part of our healthcare conversations.
My pleasure.